I'm so glad you're back. I missed you.
We are in Isle Lacrosse doing a spay-neuter clinic.
We have too many puppies in our village, way too many dogs.
We have a hawk in today.
We don't know what happened with her wing.
I'd like to take an x-ray. If it's quite badly broken, euthanasia is the kindest thing.
Bijou seems to be in quite a bit of pain.
This isn't good.
She's not doing well. And the question now is, do we do surgery or not?
She is my heart, for sure. Love you.
Across the country,
Be nice.
Indigenous vets are using their knowledge and skills
A good little baby.
to help the animals we love stay happy and healthy.
Come on, let's go. Come on.
I brought Slim in today. He's a silver lab. We've had him since he's been 8 to 10 weeks old, and he's almost 11. Good boy. Slim means unconditional love to me. He loves to snuggle and give kisses, and he's always there for you. Sit.
Oh boy. Careful he doesn't take your hands off. All right, buddy, come on over. Slim is a regular patient of mine. He has a back injury from overdoing it, let's say, as a lab. Do you need Lexi to hold you? So Slim has a history of some back issues.
Yes, he was x-rayed with some spine degeneration.
Yeah. So he has age-related chronic pain that I just can't help by writing prescriptions. And so he comes routinely for acupuncture treatment. I sustained a pretty significant back injury quite a few years ago. And after weeks of rest and medication, my back pain was still really bad. You're okay, big guy. But within a week of acupuncture, my pain had improved dramatically and my mobility as well. So these needles here are trying to treat a bit more of the focal area where his back lesions are. Western medicine works to treat many things, but there's also a benefit to Eastern medicine as well.
Does he get needles in his feet?
Well, I try, but he hates it.
Yeah.
He has a limit, and let me tell you, he lets you know if you get near his feet. And so then I started to reflect on how maybe this would benefit some of my patients that have chronic pain.
And I can almost tell when he needs it again. Like once in a while, he'll yelp when he moves fast.
With acupuncture, it's definitely given a lot of my patients a new lease on life, extended their life, and improved the quality of their life. This will be the last needle for him. Stay, buddy. You're okay.
How long do they stay in?
They usually stay in 10 minutes.
We're just trying to help him feel good, and we'd like to keep him comfortable and keep him as long as possible.
He's trying to eat the lick mat. You are definitely a character when it comes to food.
Dr. Stephen, oh, wonderful. Very compassionate.
Be nice. Good boy.
Very thankful to have her.
All right, buddy, you're done. It's all over, Red Rover.
Thank you.
Yeah, you're welcome.
I hear we have a hawk in today.
Yes, we have a sharp-shinned hawk. It's an adult female.
Living Sky is a wildlife rescue/rehabilitation center. We work fairly closely with them, offering them a space that they can bring in some of these wild animals so that we can examine them and just see how they're doing.
So he does have a tail guard on.
Okay.
To prevent any feather breakage. A finder brought it into us and said, hey, I found this hawk. It's not flying, but we don't really know what happened with her wing.
Once you feel comfortable holding,
I can grab his feet. Raptors, they're one of my favorite things to work with. They're so interesting, so majestic.
I know, you're doing great. She may have broken her radius and ulna, which is kind of this part of the arm. It potentially could be quite serious. Ideally, I'd like to take an x-ray.
Yeah.
Depending on what we see on our x-ray, if it's quite badly broken and rehabilitation might not be an option, then euthanasia is the kindest thing we can do for it. Sorry.
Just like that.
Once we put a little cloth over her face just to help take away some of that visual stimulation, she was as calm as a hawk can be on an x-ray table. X-ray!
Fingers crossed it's not broken or broken in a good place so it can heal.
There is a fracture at the level of the wrist here, but it looks like that it's still in line. It is a small fracture. I have high hopes for the hawk that she will be able to heal that up on her own, especially because the bone is beautiful in its placement. We're gonna recommend rest, continue on with the pain medication, and then we'll just see how she does.
Thank you so much.
No worries.
When she was hopeful that it could heal and we want to give it time, that made me really happy that the hawk will be able to be released one day.
Thank you for calling in Chaco Valley Animal Health. How can I help you?
I'm heading out.
Okay.
One of the great things about this practice is that we are really a great team together. If you have any questions, give me a call. We can really rely on each other and lean on each other. Have a good day. Okay. All right.
Dr. Steven left. She had to get going to a meeting, so she left me in charge today. Okay. Can you sit? Good girl.
Caitlin has been with me for 10 years. She is extremely knowledgeable. She is my ride and die.
And she's good to go.
Hi.
Bijou came in. The owner had noted that the dog had some blood in its urine.
This isn't good.
Poor thing.
I call her my rainbow puppy because my original Shih Tzu died in a house fire, and she's what has kept me together. And now I have to try to hold her together.
She pees as soon as I touch her abdomen, and then when I palpate her bladder, I can feel that it's crunchy, which usually is a red flag. So I think we should take an x-ray. I put her on her right side. Yeah, that's better. Ready?
Yep.
Okay. Just tight. Oi. Ouch. The x-rays are pretty shocking. So we'll have Dr. Steven have a look at that. Just calling Dr. Steven to have her have a look at these radiographs. Dr. Steven left me in charge of the last appointment today.
You're okay, Bijou.
Bijou's owner had noted that the dog had some blood in its urine, and the x-rays are a little bit shocking. Some stones in her bladder, quite a few. Hi. So here's her lateral.
Yeah, okay. Well, those are pretty bad.
Yeah.
There is a family of stones, these rocks of minerals that have formed in that poor little dog's bladder. They're so large.
Those are giant.
Yeah.
The stones have grown to such a size that the bladder just doesn't have anywhere more to go. The kidneys want to produce urine, but there's nowhere to store it, so then it backs up.
Stones that are that size need to come out. She needs to be scheduled for surgery.
Okay.
She must be so painful, and she's not going to get better if we don't remove those stones.
So these are her bladder x-rays. 1, 2, 3, 4, 5, maybe 6. Those are all bladder stones.
Wow.
We're gonna start her on antibiotics,
Okay.
pain medication, and then we're gonna have to take her to surgery to get rid of those.
Perfect. This sounds like something we can do something about. Well, thank you so much.
Yeah, have a good night.
She will have to have a surgery, but she's worth it. Come on. Bijou is everything. Yeah.
We are in Isle Lacrosse.
Come on.
It is a Métis and Cree community located in northern Saskatchewan.
Hi, Colleen. It's Jordan calling from the vet clinic at the school. How are you? This clinic is an opportunity for Violet Lacrosse to have access to on-site veterinary care. The closest clinic's about 2 hours away. And so it's very difficult for people to get their pets spayed, to have their vaccines.
I'm just gonna feel your tummy, okay?
Right now in some of our northern communities, we're having an outbreak of parvovirus. And when we don't have vaccination, a lot of animals can die. So this is a great opportunity for us to get in here and make that care accessible.
We'll open up a new tin of baby food just for you, Brutus.
Good girl.
Only here for 2 days, and so we want to make sure that we can see as many patients as we're able to. 1, 2, 3. We know that it's going to be pretty fast-paced and crazy.
Up like that?
Yeah. Beautiful.
Let's go, my dog. I'm Cree, and I'm from Isle Cross, and it's called Sakto Sagahigan. And it's a meeting of rivers. I have another location that I live, and it took me an hour and a half to get here by boat to come and bring my dog, Dora.
Hello. Are you ready, Dora?
Because I really don't want to have any more puppies. We have too many puppies in our village. Way too many dogs.
Good girl.
She's raised her own children, so she's very, very, very kind.
She's looking good for surgery.
And she knows she's pretty.
We are about to spay Dora.
Are you cutting or am I going to be cutting?
You're cutting. So we do have some fourth-year vet students here with us. Do your best to stay on linea. It should be a little bit crunchy. They're learning about the culture here in Isle Cross, and they also get to kind of take main surgeon role during the surgeries up here, which is awesome. Just always be mindful because there can be big, sneaky blood vessels. Yep, you got it.
I haven't been to a clinic like this before, and I was definitely nervous at the beginning going into things.
Yeah, there you go. See? Yeah. You're doing great.
But if you have a really good mentor, you just like build on your confidence and your overall skill set.
Happy?
Yep.
All right, 1 down. I love seeing them be maybe a little bit unsure or hesitant at the start, and just seeing them by the end feeling that much more confident in themselves. Okay, awesome. Good job.
Coming to the end of the day here, and things went awesome today. We were at capacity.
Pretty girl, come on.
But there's more work for us to do. So tomorrow we have more surgery patients coming in.
I'm exhausted, but I'm feeling awesome. We just have a whole bunch of animals who aren't gonna make a bunch of puppies and kittens. All of them have been vaccinated, and so rabies, distemper, parvo, like real serious diseases, we've put at a lower risk in this community because of that, which is just awesome. Okay, see you guys tomorrow.
Bijou has bladder stones, so she's here today for surgery to remove those.
I think she's gone downhill a little bit. It seems to be in quite a bit of pain.
If we don't go ahead with the surgery, the bladder stones are definitely going to shorten the dog's life.
She cried most of the night and is getting quite wobbly. In the last week, she's really withdrawn, stopped paying attention to what's going on around her. She hasn't eaten anything solid for 4 weeks. Okay. Not drinking a lot. I feel fear, anxiety. Love you. She's going into this less prepared than I'd like her to be, but.
Why are you so cold? This dog is real cold.
Bijou presented today with a low body temperature and a history of not eating for the past few days, and that to me is quite concerning.
Hi. Your bladder sore? You're pretty tacky. She's quite dehydrated for sure.
She's not doing well. And the question now is, do we do surgery or not? Because putting her under an anesthetic is the concern with her in the condition that she's currently in. Let's get a catheter in her and let's get her on fluids.
Okay.
She's gonna need to be rehydrated and we need to warm her up. I'm gonna give the owner a phone call and update her. Hey, Allison, it's Dr. Corey. How are you?
Hi, that's better now that she's with you.
Okay, good. We have her on IV fluids and we're gonna try and get her temperature up.
I don't know whether she's giving up or whether maybe she's been in too much pain.
We'll take her to surgery this afternoon if she starts to normalize.
If it was
Destiny.
Inside, music loud, crowds alive. We'll survive, oh we'll thrive. In this moment, stay inside. In your arms, the world is wide. Music loud, crowds alive. We'll survive, oh we'll thrive. In this moment, staying right. Flying high, no end in sight. No end in sight. No end in sight.
To be a bad outcome, it would be a void I couldn't fill, I'm sure, but...
We'll talk to you in a couple hours. Okay, bye-bye. She's a surgical risk right now, but at this point, she's not gonna get better if we don't remove those stones. Bijou is not doing well, but she's not gonna get better if we don't remove those stones.
Her temp is up to 37 and a half.
She's still not 100%, but her vital signs have improved.
Are you gonna be okay with that?
Okay, at this point, the plan is to go ahead with surgery. From the looks of those stones in that bladder, they need to go.
Okay, come on.
It's going to have to be a surgical risk we're gonna take. We just need to get this done. Okay, here we go. All right, sweetheart. Let's get your bladder out of here. Look how angry that is. Yeah, I don't love that. The bladder wall, because it's so angry and it's been so chronic, it's been a long time. The worry is that the tissue is just gonna fall apart. Hopefully, that doesn't happen. Oh, I'm just sweating under here.
Me too.
That's the stones. It's a struggle to get the first one when they're that large. They're giant, they're chestnuts. Oh, your bladder's gonna feel so much better.
It probably already does.
Oh, I can't even imagine. Okie dokie. Good little puppy. I sure hope you feel better.
Me too.
She's done. So I guesstimated 6 on an x-ray, and that's what we removed. We'll use the x-ray to confirm that there's nothing left.
Here.
Oh, so good you are.
Oh, she's ready to leave. Okay.
Are you tired?
I'm exhausted.
Are you?
Sorry. Not gonna cry anymore.
Oh, I think it was extremely emotional. The owner feels worried. Is she gonna make it? Who's here? Look it, it's your mom.
Hi, sweetie pie.
Oh my goodness.
Hello. You recognize me today. Hi. Hey, you wanna come home? Hi.
Bijou's done well. She ate treats for us just now.
Yeah.
She ate a can of food today. We can breathe now.
She is my heart for sure.
I know I love you too. Yes.
Some days it's goodbyes and sadness, and other days you get cases like Bijou and you get great outcomes. So we have to rejoice in that. All right, you guys get some rest.
Yeah, I think we'll curl up together and do that.
We are in Isle La Crosse, Saskatchewan. and it's the last day of the clinic.
He gets freaked out, that's why.
Mm-hmm. Especially with all the other cats, eh?
Yeah.
Yeah.
I brought in my cat, Midnight, to get neutered. He has white fur on his hands, and they look like mittens. He likes to hiss. My last cat recently passed away. Then I was sad for long till my mom got me a new cat. When I hold Midnight, he makes me happy. I'll be back, my boys.
It's really important to spay and neuter pets, especially cats who are going to be outside. You're doing great. You're gonna make an amazing vet. You're gonna be like the best testicle plucker they've ever had. Single breeding pair of cats, if left unaltered and having, a certain number of litters that is very capable of them, it can lead to thousands of kittens within their lifetime. You go for it, Danielle. Danielle's done a number of these by herself, and so she was really confident with that, which is excellent. Beautiful. Good job, Danielle. Thanks. Now Midnight is gonna wake up, we're gonna give him some pain medication, and he's gonna go home and not be able to make any more babies.
I'm so glad you're back. I missed you. Thank you.
Thank you, guys. Having Indigenous veterinary professionals like Allison, who's doing so well and is so accomplished and so capable.
Oh, thank you.
Is incredibly important because that means that the youth who are here, who come and watch what we're up to, see themselves in these professions. And that's really what we want to be able to do for our Northern and Indigenous communities. Hi, Dora.
Good girl. Come on. We've completed all of our surgeries, and so all of our patients are ready to head home.
She's in really good shape. She's a really healthy gal. She's gonna heal up nice. We've done about 65 spays and neuters.
Thank you very much.
Yeah,
and
thank you.
We'll see you again.
Yes, we'll be back next year.
Dora is very important for me. Come on, dog. Nice dog. Nice dog. It's okay. You're all right. I have wolves, big black bears, coyotes in front of my doorstep, and that's my alarm, and she'll awake me. Dora is just my sweet puppy, and she's a good friend.